surgical cricothyroidotomy that we are doing it late. We are doing it late. This is the main problem.
Right. Now let's move and do the reflexes. So we have 3 reflexes in the upper limb. Okay? So we have the biceps. Can you put your arm like this and relax? I'm gonna tap on here. I'm not gonna hurt you, okay? So this is biceps. Alright? C5, C6. Alright? And then brachioradialis. C5, C6. Okay? And then triceps. C6, C7. Clear?
That the initial introduction, the process will be same. Task will be divided into?
3. 1.
Yeah, we're going to ask the patient, what do you mean by this? Let them describe their symptoms. And then we'll ask them, is there any loss of consciousness? If yes, one pause. If there is no loss of consciousness, is there any spinning? If there is spinning, peripheral, semi-visible blood beneath the gloves. So all these increase the risk of transmission of the disease. So it will be considered as a high risk patient. Okay?
And if you can see my fingers, yes, you can point out your finger to that side. Okay. Can you close? If you can see my finger, just point it.
So this is a type of dilated cardiomyopathy which happens at the late pregnancy, which you call it puerperal cardiomyopathy or peripartum. Peripartum cardiomyopathy.
And now, this diadochokinesis. This to assess the cerebellum. Can you do like that? Excellent. And then the other side. Quickly this diadochokinesis.
Went into cardiac arrest and you discover that this is beta blocker overdose. So here we need to give high dose of glucagon. Yeah, up to 10 milligrams.
Okay? When we come and assess for alcohol drinking habits, we need to start with introduction, okay? And then we will assess for evidence of alcohol dependence, as you can see there. And then afterwards, we should also assess for evidence of alcohol withdrawal. And then we will take brief medical history, and then we will give our advice.
1, 2, 3. 1, 2, 3. 2, 3. 1, 2, 3.
30 seconds passed.
This will assess him. How is the breathing now?
So still no breathing.
Yeah, just again resume CPR.
Heart rate is 30.
30. Yeah. Resume CPR. We need to insert a line with umbilical vein catheter or line, and we'll give him adrenaline.
Umbilical catheter inserted.
Yeah.
Nothing for me to think about non-accidental injury for this.
So you are not happy to go
I'm not happy to do that, but I cannot convince him. What I will do, please help.
So how old is the child now?
2 years.
2 years, and the fracture was in the mid shaft of the femur.
Yes.
Right. So the main reason that because you know the family, you think that the family they have a good parental posture and they are not going to harm the kids in any way.
Yes, that is right.
Okay, that's fine. So just we are working in the hospital. We are working as a healthcare provider. So sometimes or almost always our task is just like to detect any possibility of neglect. Okay. Any possibility of non-accidental injury and to raise it to the authority.
Let's just apply high flow oxygen 15 liter via non-lethal mask.
High flow oxygen 15 liter. Started.
Okay, we go to B, breathing, just expose the chest.
Chest exposed.
And attach the monitor.
Okay.
Monitor connected.
Can you please check the trachea central?
Trachea central.
Palpate both sides of chest
No crevices.
and chest expansion.
Chest expansion, left side is a bit.
Here, chin left, like this.
Okay,
Okay.
that is okay.
If trauma patient, you can do like this. Put the heel, both heel. Huh?
For example, she will tell you that I have 4 patients. One of them is coming with abdominal pain, elderly, okay? So the patient should, she wants you to come and see the patient. So it's gonna be triage, okay? And also she's having a lady with lower abdominal pain, female of childbearing age, okay? And there is a couple of patients, one of them with chest pain, is young, hemodynamically stable, with past history of pneumothorax. So let's say those are the patients, okay? So you need to identify the concerns about the patients. For example, the gentleman who is 85-year-old with abdominal pain, that could be, you don't know, could be abdominal aortic aneurysm, could be bowel ischemia, could be inferior eye, you don't know. Alright?
Arterial line, it is contain a needle. This is a needle. Okay. And there is a catheter for the arterial line, and this is the guide wire. Okay.
So the chest, okay. I will do palpation to the trachea, central, okay. And the chest, any
There is no abnormality upon inspection.
okay. Chest expansion,
Symmetrical bilateral.
okay. Auscultation,
Good air entry. Good air entry. Good air entry. Good air entry. Normal heart sound.
okay. And is the heart sound,
Normal heart sounds.
Okay? And he might not have any mental illness at all. Alright? So still, you will, you remember the principles of mental capacity. So if you go back to the principles of mental capacity, the patient, you should